Hello and welcome to another episode of Health Matters on Channels Television. It's great to have you tuned in. I am Mary Alale Yusuf. There's a part of the body that is usually ignored. How many people ever think of the health of their feet? Yet, that's the foundation on which the whole body is supported. The human foot has 26 bones and 33 joints. If the feet are painful or unsound, it can affect other parts of the body like the knees and the hips. 75 to 80% of the adult population have some form of foot problem, and women are 4 times more likely to have foot complaints than men. My guest on the show is Professor Babatunde Sholagberu. He is a consultant orthopedic and trauma surgeon at the Lagos State University Teaching Hospital, that's LASUTH, and a professor of orthopedic and trauma surgery at the Lagos State University College of Medicine, that's LASUCOM. He's also a fellow of the West African College of Surgeons. You're welcome to the show, sir.
Thank you very much.
Now, apart from the obvious walking, everybody walks. Maybe that's what causes foot pain. But not everybody gets the foot pain. So I have to ask you, why are they having foot pain?
Well, thank you for bringing me onto this very educative program. I will not be surprised if the number of people that will watch this program will be up to 5 years number of patients I will see. And that's why I really accepted to be here.
Thank you.
Now, you mentioned walk. The foot does more than walking. You stand on it,
Okay.
you dance with your feet, you run, you jump. Even after jumping, the landing pad is still the foot. So it does quite a lot of things. And like you said, not everybody who does these activities will have foot pain. There are so many things that will affect while you have foot pain or you will not have foot pain. And one of it will have to do with one, everything has a structure. Luckily, you mentioned now that there are
26 bones.
26 bones that make up the foot. If there is a problem with number or a problem with shape, okay, even when you now have a foot, it has 2 arches. There's one we call the longitudinal arch, and then you have the transverse arch when the 2 are put together. So once the structure has changed, the function will change.
Okay.
For example, I'm sitting on a chair now. It has a particular shape. If you remove one of the supporting structures, the chair will start having to shake. So once that happens, don't forget, the foot will now bear the entire body weight. Then if you now also carry excess weight beyond what the constitution of the foot will take, beyond the bones you mentioned, there are, by the way, 100 ligaments.
100 ligaments?
Yes. You said there are 3 joints, 26 bones.
Those
Yes.
are the bones there.
100 ligaments, yes. So you put those ligaments on that stretch. And when you see, there's also what is acceptable graduated way of exercising.
Okay.
Some people without guide want to exercise today and become whatever they want to be within 4 or 5 days. So you stretch this thing, so it will give you some pain. So, and of course there are some illnesses, okay,
that cause pain.
You can have injuries to the foot. If these ligaments are torn, the bone can break. You can hit the foot against any object in the house, a chair. Very minor accident that you would think nothing has happened, and the pain persists until you visit the doctor. Then an X-ray is done, then the fracture line is seen. Some issues are inherited. Well, there's another way we use in medicine. We call it familial. Okay. If we don't pick a particular genetic causation, but you may see a father or a mother having some foot abnormality. The same way you see a child and say, oh, you resemble mommy, you resemble daddy. So the foot too can resemble
the dad of the mom.
Yeah. So you have familial tendencies in these situations. So infections on the foot, okay, diabetes.
Like athlete's foot?
Well, yeah, athlete's foot, yes, that's a fungal infection in the crevices between the toes. And then that can happen. Of course, that's acquired from sharing shoes or dipping your legs in water where you have fungal and things like that. Basic hygiene will take care of that. What I even mean by infection can occur from most people know diabetes, a metabolic disease where sugar in the body is not well handled. It's not driven into the cell, okay, for several reasons. This is not a talk on diabetes,
Yes.
but diabetes can affect all parts of the body. The foot is one of the major areas of affectation. And there can be a cellulitis. That's an inflammation of the soft tissue layer under the skin. And then that can go on to affect the muscles of the foot, can go on to affect the bones of the foot. And the overall extension is you now have an ulcer. Ulcer means the skin is broken. And skin is what gives protection to the entire body.
Okay, so the diabetes causes the ulcer, and that causes the pain.
Predisposes.
Okay.
I'm trying to use, because there may be some doctors also listening, okay, so that it's both educated for doctors and non-doctors, but basically for non-doctors. So we'll say diabetes will predispose to ulceration, the skin breaking. Now, and this is an individual who cannot handle infections. We all have soldiers in our body, our immune system. They are like the soldiers of the body. So that is defective in a diabetic patient. So the infection can just spread and become much of a problem to diabetic foot.
Okay, explain this for us.
Yes.
Why are women more likely to have foot pain than men?
Well, I am sorry to disappoint you. I have not done sufficient work in that area to agree with your assertion that women may have it. But there are certain things we all know that differentiate men and women. Women love shoes. Everybody knows that. In fact, some people's shelf for shoes and bags, you know, it's only comparable to men's ties, if you put it that way. And some of the shoes women wear, they make their choice based on fashion rather than on health.
Okay.
My plea will be that, yes, fashion is good, but also be conscious of the health, you know. So maybe that may be one reason that, and many of these shoes are worn without consideration to the shape of their foot. As I told you, some...
But aren't shoes like one design fits all kind of thing? Nobody comes and personally measures your foot for your shoe. You just go to the shop and buy.
I would rather think that that may be an area of future development. Because now, but I think it's also part of the freedom the whole world wants. If you start making a legislation now that certain shoes should be earth compliant, you get it? Those who wear the shoes may say, why are they controlling the kind of shoes we wear? So, but I think there should be some, just the same way that vehicles are not just put in the market. They undergo some certification for safety. For God's sake, our feet, they're like our cars. We invest millions buying cars. We don't bloody care about our feet, if you get what I'm trying to say. So I think we may drive ourselves, if we do sufficient research on how shoes are hurting our feet, to sort of now making a demand for certain legislative control on what type of shoe you should put in the market.
Okay, are heels, that's high-heeled shoes, are they dangerous? Are they bad? Because that's, you know, an exclusive preserve of women. They like the high heels.
Yes.
Are they in any way bad for the foot?
Thank you very much. I think a generic answer of bad or good will not be the issue, because, I mean, to be fashionable is a good thing. Okay? So I would rather think that women should look at their own peculiar fit, and based on the individual, you can make a recommendation or of course, I think people have found a shortcut towards this. When they wear the fashionable shoes, they don't wear it from their house throughout to the occasion.
Carry it in a bag.
Yes. So, but I think this kind of control, a future control that is helpful for the industry and helpful for the fashion, is it fashionista you call it now? I mean, the person who is interested in the fashion, because it's the emotional part of man is important. Of course, when you see your wife with beautiful shoes, you love to see her in that way, or your friend wearing beautiful shoes. Everybody makes a comment, oh, I love your shoes. But I'm saying, yes, fashion, you should also balance it with what is a health consideration. Because in the long run, when it hurts the foot, because you see, those bones, once you wear these shoes and they start misplacing the way the ligaments can work, or start hurting the skin, and they can throw some of the toes in a funny shape, or you predisposed to having an injury, the injury will result in a deformity in the foot. For example, there is one we call hammer toe. I'm sure if they have the picture.
Okay, that would be...
This is a corn, for example.
Okay.
In fact, this has quite a lot of abnormalities. If you check that, you see the big toe.
Yes.
And the second toe is overriding.
Almost, yes.
And there is that ball on top of the second toe is a swelling.
Yes.
Okay, that's an exaggerated corn, you know. And even if you look at the alignment,
that is painful, isn't it?
Very, it will be. And somebody will say wear a tight shoe on that, because the person's interest is in the fashion. Oh, I love this shoe; it matches my.
So what
bag.
eventually happens when the person just keeps wearing tight shoes on this kind of thing?
Before it's a vicious cycle of continuous injury.
Oh.
Okay, even you have not even looked at that big toe. That is a hallux.
The toe is curved inward.
Yes. So
but you see, what we were told when we were younger is that women especially should wear shoes that will do that to their toes, that will close them up so that their toes are not spread apart. That it wasn't pretty to have spread apart toes.
Well, it doesn't have to be spread apart, but it must be straight, because there are consequences to this deformity. This is a deformed foot, for example.
Okay.
That area will soon develop what we call a bunion.
Okay. That's right there at the bottom of the big toe.
Yes, the big toe, that angle.
That angle.
Yes, because that is the area of unnecessary pressure. And the body is action and reaction. The body will react to all problems. So, as I said, it is an improvement in the health of the shoes, because once there is a disease now, in giving a treatment, it might involve special shoes to be prescribed.
Okay, so if somebody were to go and buy shoes, for example, what would you ask the person to look out for a perfect fit?
Well, first things first, you have your shoe size. So I think
so don't buy smaller shoes.
You should respect your shoe size. You know, that's the first thing to say. But you know, the problem we all have sometimes is maybe you are size, let's say 38, and then the one you really love, the color and all that, is a little smaller, and it's okay, no, I must wear this and all of that. So I think the general thing to say is it's difficult to make prescription for everybody, but one can go with a general principle. Be fashion conscious about your shoes, just the same way you consider the health implications. Of course, the more you put on any pair of shoes, that wearing it gives you a lot of pain. That's a prescription. Some will start saying, oh, as you wear it for longer, it will stretch and all that.
Yes.
Let the manufacturer tell you that. You see, not you who didn't manufacture the shoes say that will happen.
So a safe guide would be feel comfortable in the shoes.
Yes. So
let's take a short break, sir. When we come back, we'll continue. We're taking a break. Remember, after the break, your questions, your comments, and if your tweets come in time, they could be treated in a minute.